My name is Crystal Hall. I am with the Department of Helping Citizens of Virginia. Today we are going to discuss the Zika virus and what we can do to stop the spread of the virus. The Zika virus is a virus contracted from the bite of an Aedes species mosquito. The name Zika comes from the Zika forest in Uganda. The Zika virus is associated to the dengue virus, yellow fever virus, Japanese encephalitis virus, and West Nile virus. This virus started infecting the United States in 2007, and the virus has spread across the Pacific Ocean, leading to the Zika virus epidemic of 2015-2016. The spread of the virus is done by a female Aedes mosquito, which is active during the daytime. Researchers also found that the virus can also become contracted in common house mosquitoes. The mosquitoes must feed on blood to lay their eggs. The transmission of the virus can be done from a mother to her unborn child, causing severe brain malformities and other birth defects. It can also spread through sexual contact and blood transfusions. I would like to propose that the EPA bug repellent to be covered by Medicaid. As you all know, Medicaid covers millions of Americans, including children, pregnant women, elderly adults, disabled people, and low-income families. If Medicaid covers the bug repellent, that would be a lot of Americans that can be protected by the infection of the Zika virus. The Zika virus is a danger to our community, and we need to do everything we can to help control it. If you have been to a doctor's office lately, then you know that offices are now getting you to sign a form if you have or have not been out of the country or been around someone that has been out of the country. This is an issue taken serious in our health field. About 20% of people who gets the virus have symptoms, which are fever, rash, joint pain, and conjunctivitis, or red eye. Other symptoms could include muscle aches and headaches. As we are still learning and researching this virus, besides the fetal brain defective, the virus can also produce neurologic syndrome, but so far in a small number of patients. There isn't a specific treatment or vaccine to prevent the Zika virus from spreading. We as a community need to keep our citizens safe. If this proposal is passed, the way we can control the Medicaid recipients being the only ones to get the coverage would be they would have to get a prescription from their medical providers and submit it to their pharmacy. The prescription would have to specify for EPA registered insect repellent. I would like to end this with an update. As of today, there have been 82 cases of the Zika virus reported in Virginia to the CDC. All of these cases were associated with traveling in a Zika infested area. The CDC has issued a travel alert for anyone traveling to these regions where the Zika virus transmission is ongoing. Now, as a lot of you know, that some people just don't get out to vote. Rather, it is they don't have the time or cannot make it to the polls. Well, we fixed one part of that problem, and we all know we will drive the elderly to the polls. Every vote counts, and if you would put this proposal on your agenda, I am sure it will encourage more voters to show up at the polls, especially the elderly, which usually don't have any reason to vote. This would give them an incentive to vote for the candidate that seems to be fighting for their safety. Thank you, and have a great day.